listening to the Turn Autism Around podcast, episode number 142. Today, I had the pleasure of speaking with Dr. Fumi Horner, who is a board-certified behavior analyst at the doctoral level. And Fumi has been in the United States since 2001 when she came here from college. She was born and raised in Japan. And her interests really lie in diversity and cultural competence. She is currently the Vice President of Clinical Quality Outcomes and Research at Bierman ABA Autism Center. She is located in Chicago. She's a wealth of information about how we can do better with people from all over the world, different cultures, different religions, different races, how we can help our clients with different backgrounds, as well as improve our diversity in the workforce. It's a fascinating discussion. Hope you enjoy it. Here's Dr. Fumi Horner. Okay, Fumi, thanks so much for joining us today. I'm really looking forward to hearing your story.
Awesome. Thank you for having me.
So, same question for our listeners that I usually start with. Describe your fall into the autism world.
Sure. Well, that was way back then when I lived in Japan. I was born and raised in Japan. My brothers, our very close family friend, they have a little boy with autism. And it was just always part of my childhood, hanging out with the little boy. He was verbal. He was able to speak very basic needs and wants, but not at the conversational level. And he was always in my little brother's classroom with a little aide. He, all the sports festival and all the cultural festival that, because Japanese schools do that every year. He was always part of the group, but with the aide, and there wasn't much expectations that he has to do certain things independently. It was more of, he was there so he can be part of the group without disrupting the entire classroom activities or whatever the school activities that they were supposed to be doing.
And this was like 1990s?
That was 1990, yes.
Okay.
So that's how I grew up, and that was always part of my family. We went to a family trip together. So I saw him several times a week, entire my elementary school and junior high, and until we moved to a different location, but we still kept in touch, and I still, we are still very close to the family. And he now is probably 30 something years old, and he has a job. He takes a train to work. I saw him at the bar last time. He wasn't drinking, but he was, having a good time. So that's kind of how I grew up. And it was very eye-opening when I came to America for college. I took basic psychology 101, learned about autism, and I was always entire time that I was watching that webinar, that video during a lecture, I was thinking about the little boy that I grew up with. And then I learned about ABA for the first time, and Dr. Lava's researching at the UCLA. So that was very shocking and eye-opening, that wow, that this is what I want to do. And I want to bring this back to Japan and, do something different, that it's possibly, help more people there in Japan. So I want to learn this here as much as I can and bring it back to Japan. So that's kind of how I got into this autism field professionally.
Wow. And then you went on to get a master's and a doctorate. Was this all in California, or did you move?
Sure. Yeah. The graduate programs are all in Chicago, Illinois.
Okay. And that's where you're located now?
Yes, I am.
Okay. So you never moved back to Japan, but were you able to disseminate that information in any way to Japan?
Sure. So I very recently started working on, well, my doctoral dissertation was focusing on application of all the English written curriculum and assessment into Japanese language to see if, well, the testing applicability, and two, whether which instructions will result in a faster skill acquisition. So that was my dissertation research. And then I had my kids, my own life events. So now recently started doing some webinar targeting Japanese families who live in the United States. So they have a language, not only the language barrier, but they're raising a child with autism in a completely foreign country. And some of them their stay is completely temporary, but their kids are in the school system, the public school system a lot of times. So how to get them educated in IEP and all the insurance related issues and all the ABA that they cannot really receive ABA in Japanese, but English. So how can we at least minimize that barrier and do their best to help their child learn and acquire more skills. So I did the webinars recently, and I'm also a member of Japanese Association of Behavior Analysis, and we have a conference actually this coming week. But so I started doing those kind of things very slowly starting this year.
Yeah, it's very difficult because I mean the world is so huge. There's so many needs. So today I really want to dive into diversity and cultural differences between all countries. And I have online courses and communities, and we have people from over 80 countries who have purchased the courses and are part of the community. So there is a real a real big group of different languages, different cultures. I also on the podcast had Maria from Autism in Black, an organization. She was on episode 99. We'll put that in the show notes. She did a really good interview in terms of the discrepancies between what Black children get in terms of early diagnosis and treatment and white children. And also Smita from India. Off the top of my head, these are the episodes that really we talked a lot about, diversity and some of the problems. So what, in your perspective, is diversity?
Well, it's more of all the individual differences because everybody comes with all own differences. And when it comes to diversity, it's more of accepting how they are, that it's people will have different backgrounds and experiences. And just because you share similar or same color of skin or similar cultural, religious background, that doesn't mean that you guys will have a similar, experiences or ideas or preferences even. So understanding and accepting those differences and really respecting the way they are, and instead of changing things that it should be based on what the society kind of impels them to change or accept, what in a diversity perspective, how can we really respect those individual differences and their backgrounds, and really having a mutual understanding of how much do we need to really modify and kind of shape their behaviors into more of the appropriate functional level so they can adapt to their environment effectively and achieve their goal, whatever that means to that individual.
Yeah, I think that's a good way to look at it. I'm constantly, talking about the child. And so each child is so different. And even though they might both be 18-month-olds and they might neither of them talking, and maybe they're both American and they're both from Pennsylvania and they're both, they have so many similarities, but this child may not be sleeping through the night, may have
Sure.
eating problems, may have, big tantrums while so if we look at individual differences, and then if we pull back, like you're suggesting, and look at the family and the culture and the language and the backgrounds, it's like, wow, it does get very, very complicated.
Absolutely. Yeah. And I think that especially a lot of clinicians tend to hyper focus on, okay, well, he has to go to school. That means he has to be able to do, or she has to be able to do A, B, and C. Or because of the funding restriction, they have to stick to the medical necessity so the insurance will reimburse their services. And as a BCBA, that focusing on the social significance of the individual that we provide services for and the families who are supposed to support and be able to maintain whatever we teach during a therapy time. We want to make sure all the skills that we target are able to generalize outside of a therapy and also carried over by the caregivers and family members. So they're able to maintain over time. Like you mentioned, the language. What if the families don't speak English at home and all they see is the caregivers, the grandparents who don't speak English at all? Parents might speak a little bit of English, but the child sees the grandparents all the time and they don't speak English at all. It's really significant for them to be able to communicate back and forth with the grandparents there because they're primary caregivers. Are we going to say that no, they have to just stick to English because this child is going to public school in 3 years? Or are we going to kind of meet in the middle and somewhat incorporate their native language into the programming to help them facilitate communication that could happen at home? So I think these are very important topic for clinicians to think about.
Yeah, I know I worked with one family from India, and they now, and I don't know if this is, widespread in India or not, but this family was much more interested in their kids sleeping with them later, the family bed situation. They were also more interested in like spoon feeding the child
Sure.
well past what would be appropriate
Mm-hmm.
in the United States for Americans. And so all of these things, like, is it a delay? Is it something that we should work on if the family's not interested? It just in addition to the language, there
Mm-hmm.
are cultural differences that are there things like that in other countries, like in Japan, for instance, where it's a difference that is pretty widespread?
It definitely is, and there are so many differences, and there are differences not just as a child, but the caregiver interaction, what's common and what's expected. It's just so different. So just because what your graduate school trained you or prepare you for, to follow the medical necessity or what's appropriate for the child to be in the kindergarten, that may be different. And I think when it comes to cultural humility to accept those differences and diversity, you always have to have a mindset of that you don't know everything. So you have to really be receptive to hone into those differences and what families' needs and priorities are when they are making recommendations and working with those families.
Yeah, and you use the term cultural humility. That's basically, I think you defined it. It's basically not being humble to the fact that you don't know all
Sure.
the variables, even if you've worked with 100 families from India.
Mm-hmm.
Each family is different. And is that what cultural humility is? Because I've never heard that term before.
That's how I always learned it, and that's how I use it too. To be humble and just really receptive. Just because I'm from Japan and I work with good amount of Asian families, that doesn't mean that I know a lot of things about. Maybe I know more things relatively speaking to compared to other BCBAs or clinicians just because of my background and experience, but that doesn't make me very competent and know all the variables and needs and priorities of the individual family just because they are also they share same ethnic background with me. So just having the attitude of the being humble attitude to learn and try to understand those, be sensitive to their needs and wants, and not assuming that I'm competent just because I have a certain amount of experience or I have a certain degree, things like that.
Yeah. So if there are professionals out there and they are just saying, okay, that makes a lot of sense, and maybe I'm not going into situations, humble enough and open enough to cultural differences. Are there any 2, 3 points that you would just be like, if you were sending me into or a student into a family from Japan or from India or from wherever, are there any 3 or 4 things that you could say, just to do, the action steps?
Sure. I think that it's very important. As I'm actually heavily involved in a lot of intake process or initial caregiver. I'm not going to even call that as a caregiver training, but caregiver orientation process.
Okay.
Before even they start services for children with autism or even make a treatment recommendation, the clinician will make sure the clinicians spend enough time to get to know the parents. So the initial orientation process, parent that includes assessments and parent interviews, and having very open discussion what they're looking for, what the struggles are, and especially for some culture, I think accepting that's a struggle, even though in some culture, yes, I should be as a mother doing A, B, and C for my child no matter what, and I shouldn't be asking for help from my husband or my other people because that makes them feel that they're not doing their job correctly or independently. So they might not share those information, and they might feel like they're complaining about their child. So they have a guilt that it's in them, so they might not share those experiences with the clinician right away when the clinician are supposed to assess what's their priority, where the struggle and pain points are for the parents when they are creating some goals and plan for them. So really spending time building rapport, getting to know them. And I think building this relationship at first, especially now with the COVID restriction, I think doing this remotely may be a little bit of a challenge for a lot of them. However, I believe it's very important to spend enough time with the family, and not just mom, maybe many caregivers as much as possible, to really assess what their experiences are like. So their goals and plans, the clinicians' goals and plans are aligning with what the parents the caregivers and families are looking for.
Yeah. So we also have to look at diversity in the field of autism treatment in terms of BCBAs and students and RBTs and therapists. Can you speak to that at all?
Sure. Well, I must say, well, from my personal experience, working as a therapist and then becoming a BCBA, even finding a practicum, so the internship experience to become a BCBA, or even finding a job to become a behavior therapist, they were extremely difficult for me. I remember I called so many companies and clinicians inquiring if there are opening, even though now look at the field that it's always a lot of companies are always hiring for behavior technicians and going through a lot of short staff situation. But back then I needed to call, and then there was some people will tell me that with the language barrier, it will make me extremely difficult to get this kind of job because it's very language heavy, and I have to be able to jump into those families and be able to communicate with families and parents professionally. And my language, frankly speaking, it wasn't really, I guess, there by the time when I was looking for that type of job. So it was extremely difficult. And I think I must say that, but it was about 10 years ago. So a lot of companies didn't have a lot of training system to prepare their staff to have a professional conversation, what to do when child does this or parents ask those questions, how to answer. So they didn't have those systems in place. So they really needed to rely on individuals who's coming to work for them that have already those prerequisite skill ready. So they didn't have to be responsible for teaching everything. But yeah, finding those type of jobs was very difficult as an international student. And when I finished my master's degree, finished thesis and passed BCBA exam, I just knew that I wasn't ready. I wasn't ready to competently work with all the children and the families and do the best service I could. And especially I was back then still thinking about bringing the ABA back to Japan. So that was the reason that I decided to pursue PhD to further my education and knowledge. But I think having the training, that is thorough training for RBT level or the behavior technician level, and also the BCBA to prepare those clinicians who are interested and could come with a very various background, including the language that they speak. So they are still able to competently, adequately learn what the teaching objectives or training objectives were from the training course or the graduate program course, and be able to provide feedback. And like I said, just being humble and sensitive to those differences, but without compromising their standards, how can we still set them up for success and assist them to achieve the quality clinician standards, what they can do. I think that has been that was a challenge for me when I was the practicum student and working as a new clinician. So that became my passion now, that how can I create training and quality assurance system to detect some pain points and improve our current training systems.
Do you have now you work, what's the name of the company you work for now?
I work for Bierman ABA Autism Center.
And that company is in several states, right?
Correct.
Right. So how diverse is your workforce there? And is that something that you're constantly trying to get more diverse, or?
Sure. I don't have an exact number. I apologize. However, I don't think it's that diverse at all. And I think it's very common in ABA field. It's not just the company that I currently work for. My previous company that I work for, they got the statistics to really identify what's the ratio or the percentage of the racial or the cultural background of the entire employees. And it was still not proportionate to population in the United States. So somehow those minorities, the Black, Asian, or Hispanic population was significantly smaller, especially for the behavior technician, it was similar, but for the BCBA, the supervisor level, it became disproportionate to the actual United States
and is
population.
that what we see in, I'm like, I don't know any statistics, so I'm just kind of interested. So do you know, like in terms of BCBAs?
I do not I do not know. I do know, and I apologize, I don't have a most up to date information. But even like a BACB releases that the how many certificates are from certain country, and that was my last in person conference. So that was probably 2019. They were saying that there were not even more, I think less than 10 BCBA D level clinicians in Japan. So they were showing us statistics
Oh,
of
wow.
where, so it's very small amount of populations. Well, specifically for Japan, because of the funding for ABA doesn't exist. So there's no point really for a lot of people to even
And
get that kind of certification.
most countries, ABA funding does not
Mhm.
exist. Like
Absolutely.
there's very few countries. The United States is definitely the most advanced in terms of funding
Sure.
for ABA. And so it makes it really difficult. And I know BACB, which is the board that certifies, that maintains credentials for us as BCBADs and for all the BCBAs and RBTs. A few years ago, before COVID, they made some tough decisions and actually are stopping the international certifications,
Sure.
translations of the exams, and one of their points was it is just such a little number and such a huge resources monetarily and just in terms of logistics. It just wasn't possible. And I haven't had any conversations with anybody in charge at the BACB, but I know we're talking about diversity and cultural competence and expanding the BCBA and BCBAD levels throughout the world. But I think it's not going to get much better if there's no testing in other languages. And there it did definitely put a halt to some of that movement.
Yeah, my understanding for that is to really help the their own board or association like that in each country to develop, instead of BACB kind of going outside of the United States or Canada to kind of, I don't want to say the word dictate, but basically setting the guidelines and standards. So like
and to monitor and to create and yes, I do remember that. Thank you for pointing that out. Is that they do want other countries to develop it, and they just felt like they couldn't do it to the degree where it would make sense because of all these cultural differences and logistics and it's kind of each country needs to develop funding streams, and that just takes years of advocacy.
Absolutely. So that's the biggest reason that I wanted to go back to Japan. That was so remarkable when I learned about ABA and autism treatment when I lived in California, was that in Japan, well, at least to my knowledge, it's a lot of public school system, they go to either general education classroom or special ed. It's not really kind of separated based on the function level or the what they are able to do. It was more everybody, whoever can follow the general classroom instructions, or who cannot, and those one who cannot follow the general education classroom instructions will just be in this one big group. And there, to my understanding, there's not much transition in between. It's more of, okay, how can you still stay in this side of the group and adapt to the society and maybe learn some vocational. So there is not really a focus on how to move this group of children back in a general education or inclusion, or push them to a least restrictive environment. There was not much conversation happening back then. And I actually participated in like a parent conference in Japan over a while ago, that there were the couple of parents advocating to the state well, prefecture in Japan, in saying that they didn't want their child to use that as a kind of social studies example, because he's in the wheelchair, or because he's visibly looking quite different from the rest of the peers in the classroom. The parents were advocating that they didn't want their child to be used as an example, and the teacher will say, hey, look at so-and-so, and so-and-so has a disability, that's everybody try to be nice. So they didn't want that conversation at all. So they rather keeping their children in special education side, and they didn't want that inclusion or a little bit of they didn't want the transition. So that was the conversation that I thought that was very interesting. It had a lot of cultural implication difference the implication in terms of what the parents want, and also the expectations that, hey, we can train, and that those kids can learn, and they can learn to communicate and play with the other kids, and include them, and so they can have a more access to the fun activities and that all the other kids have access to. I think that I think just specifically that interaction that was very interesting for me, that the parents didn't really think that was going to happen, or I think they were like, okay, please don't even bother, and then we'll just stay on this side. So I think that the expectations are so different, and because of there's no funding, there's no clinicians advocating, hey, we can actually work together to expand their expectations, increase their expectations. So that made me think that, okay, the ABA is so different. We look at the environment and see what we can modify so the child is going to be successful and acquire more skills that they never had before, and coming to contact with a new reinforcer, so something that they like that they didn't like before, because we do a lot of introducing new activities and items or toys, or including peers to gradually transition that they can successfully play with, do those things independently. So that conversation, and just the whole this education and knowledge that I had a pleasure to learn here, is that, okay, I really have to somehow bring this back to Japan and do more parent webinar. And again, because of the funding, it's so limited, and there are families who are receiving ABA in Japan, but they are a lot of times either they are using TRICARE, which is the military funding, or maybe some families who are able to afford privately out of pocket. So it's extremely limited. So we are working, hoping to establish some kind of, like what you mentioned, a board or association that has an exam to set the standard for the clinicians that they provide services, ABA services in Japan. So I was actually involved in a translation of those exams into Japanese so those clinicians who are interested in getting that certification can take the exam and get certified in Japan and practice as a certified clinician. So I was getting involved with that, and hopefully that it will be a one step towards having more funding and recognition of ABA for children with autism as a treatment.
Yeah, I know my first book, The Verbal Behavior Approach, is in Japanese. It's in, I think, 14 or 15 languages now. My new book, Turn Autism Around, is actually going to come out in 4 languages so far. Japanese is not one of them. But you brought up a couple points that I think if you have a young child, regardless of where even if they are just showing early signs of autism, just a little speech delayed, no matter what language you speak or whatever, if you understand English and you can turn autism around and start the process or join the online course. But I think once it comes time for school age programming, I think that is when things get really dicey, especially as you described, like you can either have full inclusion, maybe with an aide to kind of keep your child on track, but that aide is not trained or supervised. So that's really not a great situation. Or you can have a completely special ed situation where no ABA is happening either. And without that middle, then you really don't have individualization and help. And I know a lot of families are listening out there and they're like, okay, so when we have that choice, what should we do? And, I also think it changes as the child ages. So my son, Lucas, is 25 now, and he has moderate to severe autism and intellectual disability. And when he was in preschool, and even in kindergarten, first and second grade, he was able to be included for music and art and gym and that sort of thing. But as he got older, inclusion becomes like that one parent was describing, like just, oh, Lucas is over here. He can't really understand what's going on. And it's like, I saw a t-shirt once that had on the front, I have autism, and on the back it said, don't waste my time, and so sometimes inclusion, if the other option is more, more one-to-one kind of teaching, which is good. It's just like, sometimes there's not a great choice. It's like this full inclusion with an aide that isn't trained or supervised, or just sitting in a class with doing calendar time with 6 other special ed students, neither of which are good options. So how do you help parents decide which? And I actually have a video blog that we can link in the show notes about how I would assess whether school or home or whatever your situation is, because it doesn't have to be called ABA or inclusion or it doesn't have to be called something in order to make it good. It could be a life skills class with a really talented teacher and maybe some behavior analysis, mixed in, that could be the right fit.
Sure. I think that when it comes to the inclusion with the aid into that classroom, that type of a situation, what I always recommended those families who are, because their children has prerequisite skills to be successful in that setting, but they definitely need some facilitated instruction or facilitated approach. And that has to be systematic, not just, I'm going to throw this kid into this big group of children with a little aide who has no idea what's expected or what does this child knows and that doesn't know, those type of things. So the aide has to be first trained, and their assistance has to be very systematic, meaning that I'm going to walk him through it and then be with the group and maybe do certain activities with the rest of the children. But my goal for today or this week is I'm going to provide full assistance. And because I do ABA, we'll take data on it. And if he's able to follow through with a routine with my full guidance, then I'm going to step back next week. So I'm going to gradually increase the expectation that so the child doesn't need me. I'm still be there physically in case he's having a bad day or he didn't sleep well, so he's very tired, then I can step in to support. But the aide has to be there so she or he can make the decision, take data and assess, and be able to step back very systematically and maybe reinforce the child's participation or attendance within a group. So it has to be very systematic, and there has to be what you just described. There has to be some one-on-one intensive teaching to prepare the child to him or her up for success in that group. It's not like, oh, because he can do A, B, and C, I'm going to just start sending him to this group with an aid. So in case that fails, the aid is there to support. It's not a backup plan. The aid is there to really facilitate what he or she can do in a situation and systematically for their assistance to promote the child's independence gradually. So that piece, a lot of times the school, when the schools are planning for the transition, or let's do the inclusion, that sounds great to many of us initially, but the strategic planning is missing. Therefore, Johnny is in a class, but he couldn't. He's sitting there, but he's not really participating. So, like what you just said, is it really worth his time? Just be part of the group when he's actually not learning or participating within in activities.
And a segregated special education setting could be totally the right fit for any individual child as a long-term placement, as a temporary placement. And I don't want parents out there to feel like, oh, since he couldn't quote unquote make it in regular general education setting, now he's failed, I've failed. Each child has their strengths, their needs, their neurologic differences.
Sure.
And so, it's about each child reaching his or her fullest potential. They have to be safe. They have to be as independent as they possibly can. And they have to be as happy as they possibly can too.
Sure.
And so we should all, as a field, be striving, whether that is a child with different language, first language than the class, or whether that's any child from any country and any ethnicity. We didn't get really into any religious differences, but I mean, there's so many differences now around the world. And it's great that your organization is in several states and you are heading the way in terms of diversity and research and moving the field forward. And so I do think that we are making strides in the field to help people from all countries. And from the start, people from other countries have looked to the United States for the research, for the treatment, for the advocacy efforts as a model. And hopefully we can continue to serve as a model and open ourselves up a little bit more to a more diverse workforce, more diverse clients. The other thing that is that usually moms like me, white, educated, are going to be like, looking into things very forcefully, getting in line, fighting for services. And sometimes, many times, if somebody is in this country and English is not their first language and they have cultural differences, they may not know that how persistent to be. And
Sure.
So they're already not in a great position. So we need to help those people and boost them up and give them access to ABA and to good therapy so that their children can make progress too.
Absolutely. And I think what you have is an online course for parents to possibly take, even from the parents from rural areas or country that the ABA services is only they hear about or they see on the internet, but not just really available to them. I think those online courses that for parents to take, it's something that it's very meaningful. And I wish that it's been translated in every language because that it's so needed. And some parents who contacted me because they speak Japanese and they want to, share their experience and possibly support other families who's in a similar shoe, fighting with all the school related stuff, insurance, and that, and in addition to language barrier, what to do, I always recommend, the support group nowadays, the social media, and made it so easy to connect to other people who don't live close to you at all. And there are a lot of online courses like yours included, obviously, are easily available for them. So I think I'm really glad to see there are so many more options for those families who don't have easy access to quality ABA.
Yeah, well, I learned a lot. Thank you so much for joining us. We always end the same way too. So part of my podcast goals are not just to help the little children or the bigger children. It's also to help parents and professionals be less stressed and lead happier lives. So we're always interested in knowing from our guests, do you have any stress reduction techniques or self-care skills that you do for yourself to manage your stress and happiness levels?
Sure. I do a lot of self-reflection. And when I do self-reflection, it's a very quirky thing that I do. Is that I like to be in a public and see other people around, instead of doing that in my room that it's quiet and just, yes, it's probably easier for me to just focus what I feel and how I see myself. But I like to be in the public and see the world around me. And that kind of gives me a perspective that, okay, whatever is stressing me out, it's not just me. A lot of people there have their own differences. They have their own struggles and challenges that they are, facing and also improving on a daily basis. So that kind of makes me think that, okay, I'm not the only one. Probably everywhere that I see have their own things that they are working on or things that they are struggling with. And that doesn't mean that they're gonna, be sad and angry about it. And they are completely, looking okay and functioning. So that kind of encourages me that, I could, and then really focus on what you have and not focusing on what you don't have, and appreciate things that you learn. Taking feedback, it's difficult for a lot of people, but I always see that as an opportunity for me to see the other perspectives that I didn't have, and opportunity to learn their perspectives and how I can grow from it. So that's always how I saw the feedback and those opportunities. So, and I like to be in the public places.
I like that. I know. I was just saying the other day, somebody was talking about meditation and that sort of thing. And I actually agree with you. I would rather like get out. I talk to people. Like that's what helps me reduce my stress is being more social, because I spend my day really just doing online
Sure.
things like this. And so I like to be out and about too, but I like that, kind of going out in the public and doing a self-reflection in public. That's a unique stress management technique that I haven't heard. So thank you so much, Fumi. I enjoyed getting to know you better, and I'll be looking for more great work. And can people follow you or your work, or you want to put that in the show notes, or let us know how people can connect with you if they have more
Sure,
that they want to talk about?
Yeah, I will definitely share that with you. I have a LinkedIn page that anyone could follow. I don't have my own blog or website, but yeah,
Okay.
I will be
So
happy to share
LinkedIn,
that.
Fumi Horner, is that?
Yep.
Okay. So Fumi, Fumi Horner, on LinkedIn is how you can follow her. We'll link that in the show notes as well. And thanks again, Fumi, for all your time today.
Thank you very much for having me. It's been great experience.
If you're a parent or professional and have benefited from the information you learned from me on this podcast, or from my Turn Autism Around book, or from my online courses, I would love to hear about your success. Please go to marybarbera.com/success and fill out a very short survey. On the survey, you can upload your book or podcast review, or you can share a picture or a video and tell me how your life has been impacted. I will personally review everything submitted, and I would love to hear from you. I'm on a mission to turn autism around for millions of children around the world so that each child can be as safe, as independent, and as happy as possible. By writing a Turn Autism Around Amazon or podcast review, and by sharing your story with me, you'll be able to help others find out about the Turn Autism Around resources so they can start turning things around too. I can't wait to hear all about your success at marybarbera.com/success. Thanks so much.